A little bit ago, I talked with you about sorting out feelings and exploring emotions inventories. And in the next few slides, I'd like to share with you various slides that explore verbal cues that help the client to get in touch with their emotion state. Because, as I mentioned, some clients go through a great deal of difficulty in understanding how they feel. And so sometimes we have to give them different words that allow them to search themselves, to feel like, to discern whether that emotion fits with what they're going through. So the first, under the first column, you have empowered. And empowered is the word that speaks to a lot of emotions associated with the client. So if the client is feeling a sense of empowerment, certain adjectives that might go along with it might be able, they might feel appreciated, authorized, capable, confident, confirmed, enabled, important, intelligent, proud, respected, satisfied, smart, supported, valuable, and worthwhile. And sometimes for us as clinicians, it's important that we use words of empowerment. And it's not sometimes, it's all the time. We have to bestow certain perspectives on our clients by the words that we use. And I'm a firm believer in empowering our clients through words, through adjectives, saying to the client, I'm really proud of you. I applaud the work that you did. That took a lot of guts and you did it. I'm really proud of you. You've grown, and I appreciate your effort in moving, working so hard. So not only must we help our clients in identifying words of empowerment, we too as clinicians have to empower our clients through words. And so let's say a client comes in and they're feeling really, really happy. And you know that with your client, they are not ones to articulate well what the feelings are. But you know that they've just gone through a job interview process and they received the job, and you might pull out this inventory, this positive mental state inventory, and you'd say to the client, you know what, Janice, you just returned from your job interview and it sounds like things may have went extremely well, even though you don't know yet whether you've received the job. And so what I'd like for us to do today is just explore some of the feelings that you're experiencing right now. Because after all, and I'm saying this to you all as the student listeners, it's important to help the client expand their repertoire of feelings. So getting back to the situations, you would say, the example I just shared with you, you would say, so let's explore some of the feelings that you're experiencing right now after going through this very important positive interview process. Because after all, as clinicians, we want to help the client to stay in that place of affirmation as long as possible, because some of our clients feel this sense of empowerment very seldom, if ever. And so you would then assist the client to identify how they're feeling. And so they might feel affirmed, they may feel proud, they might feel validated or valued, they may feel worthwhile, they might feel respected or important. So just allowing the client to try on different adjectives to see how it fits and how it coincides with where they are and what they're experiencing. Other times we might have to assist the client in identifying other feelings or emotions associated with being happy. The client might say, you know what, I feel really happy today. And as the clinician, you want to know, tell me what that entails. You know, you're saying to me that you feel happy, and I could tell from the big smile on your face that you are really happy, but let's explore what other feelings are associated with your feelings of happiness. And the client may identify that they're feeling cheerful and creative, they're elated and excited, they're joyful, they might be feeling stimulated and thrilled, and a host of feelings associated with happy. So it's important to help mine a little deeper to allow the client to understand the full array of feelings associated with feeling happy, or associated with feeling empowered, or associated with feeling enjoy, you know, being happy and indulge and nice and pleasing and satisfying, feeling terrific and zestful, broadening their repertoire of positive adjectives that they could use. I feel beautiful, I feel delighted and joy, I feel good. Sometimes there are positive mental states associated with loving or feeling loved. They might say that they feel adored or appreciated, liked, loved, needed, valued, wanted, worthy. And so it's allowing that client to delve deeper. You know, the client may say, you know, I really feel loved, I really feel valued, I feel appreciated. And so assisting them with identifying other positive emotions, trusting. What does that mean to the client? They, you know, belief and confident, faith, hope, resilience, reliance, secured, trust. So when looking at the verbal cues here, what the focus is to help the client to get in touch with the positive mental states associated with what they're experiencing, allowing them to explore the vast array of adjectives that coincides with what they're feeling. And in doing so, you're helping the client to expand their knowledge base or their feeling base. Other verbal cues that you might want to explore with your client, depending on the mental state that they might come in with, or aggressive or defensive feelings. And when you look at aggressive and defensive mental states, some of the primary issues that surface, sometimes it might be words that the client may say, or it might be based upon your observation of their nonverbals. But the client may come in and they may be acting more aggressive. They may seem grim, or they might seem quarrelsome or argumentative or defensive. And so helping the client again to mine a little deeper and understand what's going on or what's associated with those feelings. I said to you just a little bit ago that in anger management, one of the things that's important is that anger or aggressiveness is usually the tip of the iceberg, and those are the feelings that for some they feel most comfortable with displaying, particularly among males, young males with that. But when you mine deeper, there are other issues associated with it. So this particular slide talks about the other issues or feelings associated with it. So let's take, for example, aggressive. The client is feeling aggressive, or the client we might perceive it as angry. Our client comes in and they're really angry. And so what we would do in this situation is to allow the client to get in touch with other feelings associated with being angry. So you would say, Janice, I know that you're presenting as though you're very angry. How are you feeling right now? And the client will say, well, yes, Dr. Feast Price, I am angry. I'm angry because he did this or she did that. And of course, you want to help the client say, so let's reframe how you're feeling. I want you to say, I am angry because she did this, or I am angry because he did that. So allowing the client to take ownership of their feelings rather than projecting, she made me angry, or he did this. Taking ownership, I am angry because. And then what you want the client to also do, besides for taking ownership of their feelings, is say, now what other feelings are associated with your feelings of angry? The client might say, you know what, I feel attacked, I feel criticized, I feel hurt, I feel offended, I feel like somebody is trying to destroy me or annihilate me. And so it's allowing the client to come in touch with the various feelings associated with the feelings of aggressiveness. Sometimes the person was hit, they may have been in a fight, and all of those relate to issues of aggressiveness. Likewise, you can read some of the adjectives that go along with grim. The person might be solemn, restless, merciless, harsh, grumpy, frightful. Sometimes when people are grim, it's associated with fear, feeling that things have been cruel. And so delving, understanding what's associated: quarrelsome, belligerent, combative, disagreeing, irritable, scrappy. So just really associating those various attributes with these adjectives that are outlined before you. And also defensive. Sometimes our clients come in, they may be defensive. You might suggest something and they're really defensive. I never forget, I was working with one client who had disclosed that he was involved in homosexual activity, and he was really angry that he had disclosed something that he wanted to keep under wraps. He wasn't ready to share that. But in therapy, he shared that he was involved in homosexual activity. He wasn't comfortable with his sexual identity, his sexual orientation. And so he came into therapy and he was very defensive. So I said to him, Mr. X, I could tell you're really defensive. I could feel some negative energy here. Tell me what's going on. And the person just shared how, they didn't appreciate that they had disclosed that. They weren't ready to disclose certain things. And so we unpacked what it was that he was ashamed of. And we unpacked the importance of getting in touch with the objective reality so that you can move beyond where you presently are, so that you can enhance the quality of life. And so you have to be in touch with where the person is, their defensiveness. He felt like sharing went against where he wanted to be. He didn't want to share that about his sexual orientation. So they might be more cautious and careful, guarded, oppositional, protective, resentful. This client that I told you about was very resentful, and he presented being very resistive. He was resisting some of the things that we talked about in therapy, and he was trying to withhold, trying to be more restrained. But it was through the processing that we were able to move beyond where he was when he first came into therapy. Sometimes clients want to present a certain image. They want you to perceive them as being a certain kind of way because they have certain feelings or thoughts associated with their behavior. But when you conveying to the client and you're constantly reassuring them that you have unconditional positive regard, nothing that they say to you will change how you perceive them, then they become more accepting of disclosing very difficult information. And as therapists, we are having to constantly remind our clients that we value them, that we have empathy for what they've been through, that we are not judging them, and that we have unconditional positive regard. And so what this slide does is it presents the more aggressive or defensive mental states that the client may present with, and as clinicians we are responsible for helping them to delve deeper and to better understand some of the emotions that they're experiencing. It's also important to mention here that clients are not feeling any one issue. They're not in one area. They might be defensive and angry. They might be defensive and aggressive. They might be grim, quarrelsome, defensive and aggressive all at the same time. So it's important to recognize that our clients feel a myriad of feelings simultaneously, and it's our role and responsibility to help them to get in touch with those various feelings so that they can understand who they are, understand what they're feeling and why, and move beyond where they currently are. There are other verbal cues that are associated with fear and anxiety. And also when clients come in, we must assist them with identifying feelings associated with fear and anxiety, because if not properly handled or dealt with or addressed, it's very difficult for the client to move beyond where they currently are to the place where they're ready to be terminated from services. And the key to remember about affective interventions is that it is focused on feelings, and those feelings may be positive feelings, as we've talked about already with the positive mental states. Sometimes it might be aggressive or defensive mental states, and other times it might be states of fear and anxiety. So when a client comes in and they present with a mental state of fear and anxiety, we want to get to the core of what's associated with those feelings. So for example, associated with the client feeling fearful, they're anxious, they're concerned, nervous, scared, and worried. And of course, what we want to do as clinicians is get to the core of what's associated with the feelings of fearful. Tell me what you're fearful of. And in the client's own words, allowing them to tell us what's associated with those feelings of fear and anxiety. Sometimes there are feelings of doubt, feelings of failure, confusion, feeling stuck or stupid. I've had a client to say once to me, I'm feeling really stupid. I hope you don't take this as me being stupid, but, and they go on to share something with me. And for me, I always want to know, what makes you think that that's a stupid comment? What would give you the impression that I would perceive the statement as stupid? And they might say, well, because whenever I make certain statements about how I feel, my dad would always say, that's stupid. You never feel. Boys don't feel. That's stupid. And so it's getting the client to understand the source of that feeling, and also to let them know that, there's nothing stupid about the way in which you're feeling. It's nothing stupid about feeling confused or insecure or doubtful. But what's important is to help them to get beyond how they're feeling by addressing the core issues. Pain may be another issue, and that's associated with hurt, fearfulness. They're struggling or suffering. Sometimes there are issues associated with mistrust, and that might be as a result of dislike or doubt. Something is questionable or shady or suspicious. So allowing the client to identify these feelings and then peeling back the layers to uncover and to understand and explore what these issues are. Sometimes issues are related to avoiding. What's associated with your reluctance to going to fill out a job. Sometimes they're afraid of being denied of the job. Sometimes they want to they really don't want to work. They feel that they're being forced to. So, they're avoiding because they're doing something they don't want to do. Sometimes it's running away from something or copping out. So sometimes we can present this list to our client and say, you know what, Samantha, you talked about being fearful, and I want you to just take some time and tell me what's associated with your fearfulness. And the client will tell you what other issues are going on. They might also identify other mental state cues that are relevant for them. But sometimes as clinicians, especially when we have a good understanding of who our client is, it's our responsibility to say, Samantha, I heard you talk about feeling fearful. And I think as a part of your fearfulness, I'm sensing that you're avoiding stepping out and trying these new things because of your fear. Because as we know, clients, they feel multiple things simultaneously. So helping the client to connect their fearfulness with their avoiding, with maybe their mistrust and their pain and their doubt. So these are some of the fear and anxiety mental states that gives us cues into what our client is feeling. And not only are we to use these different tables for our clients and allow the clients to identify some of the cues, but we as clinicians are responsible for using this information to better understand who our clients are. So we've talked a lot about the fear and anxiety mental state. We've also talked about aggressive and defensive mental state cues. And we started off by talking about positive mental state cues. Right now, I'd like for us to talk a little bit about the spiritual or existential mental state cues, because oftentimes when our clients come into us, they present with existential kinds of issues, and sometimes it's rooted in a spiritual or religious context, and sometimes it just has to do with their place in the world. But some of the mental cues associated with the spiritual or existential mental state have to do with issues related to peacefulness, hopeful, feeling empty, disillusioned, or despairing. And associated with those, helping the client to come to terms with what's associated with that. When the client says, I feel really empty, what does that mean? So sometimes you might say to the client, you said to me that you're feeling really empty. After the loss of your spouse, you're feeling empty. And what I'd like for us to do is explore what's associated with the feeling of emptiness. And so you might say to the client, I'm going to present some different words, and I want you to indicate whether that also is relevant for you as well. And so you might present the word abandoned. And the client may say, yes, that's another one of the, in addition to feeling empty, I do feel abandoned. I feel now that my husband's gone, I have no one to look after me, so I feel a sense of abandonment. I feel sad and dejected. I feel like my sense of purpose is gone. My life is meaningless. And when the client says, I feel hopeless, that's a major issue, and that's one of the most profound adjectives related to suicide. When a client says, I feel hopeless, then you want to say, how significant are your feelings of hopeless? And then you want to say, have you ever considered suicide, or have you ever considered ending your life because of your feelings of hopelessness? And then you want to find out if they have a plan. Have they made specific plans associated with ending life? The most research shows that the adjective that is most linked with suicide is the feeling of hopeless. And so whenever the client talks about feeling empty, sad, you want to get to hopeless and find out where they are as it relates to their level of hopelessness. And the person might say, I'm really sad right now and I'm going through a very difficult time of abandonment, feeling no sense of connectedness, but suicide is not an option because of my religious convictions. So you want to definitely sit with the client when they say, I'm feeling hopeless or empty. When the client talks about feeling hopeful, that's a really good adjective that they use. And sometimes they might say, I'm really feeling confident. I'm feeling optimistic. And so what's important to take home here as it relates to hopeful is that when the client is feeling hopeful or confident, they have anticipation for the positive. They're feeling more self-assured. They expect positive things to happen. They're having faith in what lies ahead, inspiring and optimistic. And so when you start to hear adjectives associated with feeling hopeful, that's always an important time to start talking about the termination of the therapeutic process, because as we know, we are not working with clients indefinitely. At best, we work with them for 6 sessions in a therapeutic context. And so what we want to do is prepare the client for termination, which is the 4th therapeutic, it's not the 4th, it's the 5th therapeutic goal of the process, of the counseling process. And so when clients start feeling more confident, more self-assured, more optimistic, you say to them, I remember when you first came in to counseling, you were feeling pretty sad and frustrated about your circumstances, and you were feeling like things weren't going to get any better. And now I can hear you talk about feeling more optimistic, more positive, more uplifted. And I can tell that you're getting better, and that by the time this therapeutic process is over, you will be at a place where you're ready to terminate and go on and have a productive life. And so it's at the point when you start to hear the client talk about feeling hopeful, feeling self-confident, feeling optimistic, that you broach the issue of termination with your client. And so there are other spiritual or existential mental states that are very important that clients present with. They're peaceful. They might be the feelings of disillusioned or despairing. And as stated before, with those mental states as well, you want to help the client to better understand the feelings associated with those mental states. So we've talked a great deal about the various mental states, and we covered the entire gamut associated with positive, negative, anger and aggression, and we also talked about the spiritual and existential states. What I have here is an emotional inventory, and this is only one inventory that you could use with your client. For example, as I stated, when I did anger management, we always started off anger management with an emotion checklist or an emotion inventory. There are also inventories, excellent emotions inventories on the web, like they're the ones with the different kinds of faces, happy faces, mad, grumpy, grimacing faces. And so you could either use a list similar to this one, or you can utilize the web and identify emotions inventories from the web that are excellent. But again, you want to use emotion inventories when clients are limited in their ability to express emotions. And so it would be good to start the session off with the client identifying their emotion state, and then from there evolving into what are the primary issues they're grappling with that they will focus on in that particular session. emotions inventories are not only excellent in group settings, for example, anger management groups, they're also excellent tools in individual sessions when dealing with clients that have experienced certain kinds of traumatic experiences or persons who have difficulty in expressing their emotions. Another way by which to assist the client in identifying and conveying objectively their emotional state is the percentage chart. And so, for example, you might present the percentage chart to the client and say, here's an example of a person that might be feeling like a large portion of how they're feeling is resentful, a little bit associated with their emotions is fear, and then, and along with fear, they're really angry. Today, I want you to take a couple of minutes to draw your emotion state. And so, as we said before, clients feel multiple emotions simultaneously. And so, what I love about this graph, the graph allows you to get a more vivid understanding, a more objective understanding about the extent of their emotions across different areas. And so you might present the graph and say, I want you to draw in this circle how you're feeling right now. And I think what would be good in using this emotional graph or chart is to present the client maybe with the emotion inventory so that they have the list of emotions by which to draw from, and from the list of emotions then they go into drawing their graph, because sometimes clients aren't familiar with the full range of emotions that they might be experiencing, and the emotion inventory serves as a cue to clue them in on some of the different emotions that they are experiencing at the current time. So what's wonderful about the graph is it gives you an excellent pictorial to understand the levels and degrees of emotions, but it's also important to use the graph along with a word chart so that they could associate their feelings with words in the emotion inventory. Another wonderful way of doing it is to present emotions balloons. And so maybe the large emotion balloons might convey one particular emotion, which is the overarching emotion. But along with the feeling of sadness, for example, there might be a little bit of loneliness. The person might feel good, but by and large, there's a certain portion of happiness. And so allowing the client to present in a balloon format their emotions, again relying on the emotion inventory to draw adjectives that best correlate with their feelings. And once the client provides this information, it's an excellent segue into the therapeutic session, talking about let's talk about your feelings of sadness and how you're feeling. You mentioned that along with your sadness, you're also feeling lonely. What do you think is at the core of your feeling of loneliness? And I would really focus on the feelings associated with sadness and loneliness first, because it's easier to culminate the session into the more positive feelings like good and happy, because that's a nice way of ending session. And you could end a session without spending a whole lot of time on what's feeling good or the happy emotions that they're feeling. But what you don't want to do is end the therapeutic session focused on the sadness or the loneliness, because those are the feelings that the client will take with him or her at the end of the therapeutic session. There are various guidelines for expressing feelings or assisting clients to express feelings, because with affective therapeutic interventions, at the core is allowing or assisting the clients to express their feelings. And one of the guidelines in assisting clients to express their feelings is expressing feelings begin with the I statement. I feel angry, I feel sad, I feel upset, and keeping the focus on the individual, which gives the individual control rather than feeling like others are in control of their emotions. The other formula is I feel, and then they identify an adjective: happy, sad, embarrassed, elated, about. And the emotion inventory is really, really important here. And so the client might say, I feel happy about just receiving this job, or I feel elated about the job that I just received. So with the formula I feel, and then you have the blank and they identify the adjective about, and then they complete the sentence. It's important here to assist the client in finding additional adjectives that they use to express their feelings. It expands their vocabulary, and it also expands the way in which they view their feelings. Feelings aren't simplistic as clients sometimes perceive them to be. Also, another guideline for expressing feelings is feelings are neither right or wrong, they're neither good nor bad, they just are. So helping the client to understand that there isn't anything wrong with feeling the way they're feeling. It's nothing good about it or bad about it. It's how they feel, and they are entitled to feel the way in which they feel. Saying I feel that is not expressing a feeling. It's really expressing a thought. So a lot of times you might find a client say, I feel that she's disrespectful when she goes out without telling me. That isn't a feeling, it's a thought. So it's important to help clients to differentiate their thoughts from their feelings. And oftentimes a client might say, I feel that. I feel that she's very inconsiderate. No, you don't feel that. You think that. Because you cannot have a feeling that coincides with that. Usually it's a thought. So, and sometimes I'm even guilty of saying, I feel that I'm misunderstood sometimes. And no, that isn't a feeling. It's a thought. I am misunderstood sometimes. Sometimes I am misunderstood. So whenever a person says, I feel that, it's not a feeling. Perhaps they might say, I feel sad when I'm misunderstood. So helping the client to differentiate thoughts from feelings is very important. If I can substitute I think for I feel, I'm expressing a thought, and that goes with the previous I feel that. So when the person says I feel that, it's not a feeling, it's a thought. I think that I'm misunderstood, but I feel sad, mad, angry, embarrassed, elated. So these are the important guidelines that we must consider for expressing feelings. It's important that as we consider affective interventions that we explore dimensions of depression. And what's important about depression is that it is depression that is the segue to feelings of hopelessness, helplessness, and sometimes the contemplation of suicide. And so when it comes to exploring dimensions of depression, you must first consider how well does the person sleep at night. So as the therapist, you would ask, how well do you sleep at night? The client may quantify the amount of sleep. When you look at the DSM, clearly, as it relates to a client's sleep pattern and eating pattern, that coincides with criteria that meets severe depression and can lead to suicide. So how well do you sleep at night? What are your eating patterns? What is the state of your physical well-being? Are they maintaining their activities of daily living? Are they showering and maintaining their hygiene? Because usually severe depression entails a diminished physical well-being. You would also want to know what kinds of social contact do they have. What's their social network? Who are the friends that are they in contact with? What about family members that they're interacting with? You also would like to consider what their self-views are like, whether they see themselves as being worthless, whether this is something they view as temporary. Is it global? Is it associated with everything that they do? And so as it relates to one's feeling of hopelessness, oftentimes it's internal, it's global, and it has implications associated with various issues or situations that the client is in. And so understanding the self-views is very important. Do you ever think about suicide? Sometimes you have to cut to the chase and just go straight in and ask, are you feeling suicidal? Do you ever think about suicide? And if they say yes, do you have a plan of action? Do you have a weapon involving family members, conveying to the client that there are times by which you must violate confidentiality, and when you realize that the client has a clear plan of action, they are less willing to complete a suicide contract, a suicide prevention contract, get involved in outpatient or inpatient treatment. It's important that we violate confidentiality and make sure that the client receives the necessary treatment they need in order to avoid suicide. So basically this covers everything related to affective interventions, which is part of stage 4. There are other interventions, the next being cognitive, behavioral interventions, as well as the more systemic kinds of interventions. And so what is to follow in subsequent lectures will also continue along the lines of stage 4, which is employing appropriate interventions, but it's looking at other forms of interventions. This lecture covers the gamut associated with affective interventions. Thank you for your attention.